wound care. Back to do another review on some studies that have been done on hyperbaric oxygen therapy. This one is also open access, so you can just Google this title, Hyperbaric Oxygen Therapy for Non-Healing Wounds, Treatment Results of a Single Center, and you can pull up the information and read more about it if you would like. This was published back in 2020, so it's about 4 years old now. Um, Basically, they looked at about 250 patients who were referred to this hyperbaric facility because the patients had non healing wounds of varying duration, so they had been present for some time. Um, about 81% of all the wounds were either near complete healed or completely healed. 13% of the wounds were stable, meaning they didn't really change too much, and then only 2% there was a minor or major amputation needed. This study looked at diabetic and non diabetic wounds. Hyperbaric oxygen therapy is already approved to treat diabetic wounds and other non diabetic, non healing wounds that have been refractory or resistant to traditional wound care treatment. So, there are a couple of things that can make, I guess, increase the likelihood of wounds becoming chronic, and that's ischemia, the advanced age of the patient, ischemia reperfusion, which is the restoration of blood and oxygen to the tissues, and bacterial contamination. And hyperbaric oxygen therapy improves all of those, obviously, with the exception of changing the age of the patient. So, some of the things that HBOT does is restores microcirculation to the tissue. That does that because the oxygen is diffused through the plasma as opposed to just through the blood vessels. This angiogenesis right here, that's when new blood vessels are grown, and that's another, I guess, side effect or positive side effect, if you will, result of hyperbaric oxygen therapy, and that allows new blood flow and more oxygen to be delivered to tissues that were not necessarily getting it before. Some of the other things, again, that we've discussed in the past, HBOT is proven effective for for diabetic ulcers or DFUs, late radiation induced tissue toxicity, necrotic soft tissues, chronic refractory osteomyelitis, and ischemia reperfusion injury. And the refractory osteomyelitis is a chronic bone infection that is not getting better with traditional wound care. So you can see here, these are some of the time frames these wounds have been present. These are the healing rates of those wounds. You can see all very good. 75% was the lowest, either near or complete healing rate, and that was for complicated wounds that have been present 3 to 18 months. I am going to go over this next page here quickly. There are some graphic photos of some wounds, so if you are sensitive to those things, turn away for a moment and I'll pass over them and let you know when we are back on. Okay, so on to our discussion. Basically, as I said, 81% of all of these wounds were either nearly completely healed or fully and completely healed. Um, it's important that standard wound care protocols are utilized in conjunction with hyperbaric oxygen therapy. Hyperbarics can do some great things, but it's very important that there is regular wound debridement, dressing changes, things like that, um, to make sure that, again, we improve the outcomes of the patients. There are some other things that I've kind of highlighted here. HBOT is effective in decreasing major amputations in diabetic patients with severe ischemic foot ulcers. That's very important. If you are diabetic, there is a significantly higher risk that you will have some type of amputation. So we want to make sure that we can reduce that risk by getting patients treated with proper wound care early, and if necessary, getting them referred to hyperbaric facilities like ours sooner rather than later to reduce the risk of those wounds not healing fully and then resulting in some type of amputation. So, again, as I mentioned here, again, you can pause it if you want to read the conclusion. Um, there was 81% of all the patients showed the wound was either healed or near completely healed. There was no difference seen between the diabetic and non-diabetic wounds, and even 18 months, even as wounds had been present for up to 18 months, or sorry, more than 18 months, they still showed accelerated wound healing. So it's not ideal to have those wounds present for that long, but hyperbaric oxygen therapy can improve the wound healing outcomes significantly if it's added again before we get to the point of amputation. So, again, HBOT may decrease the need for minor or major amputations in the case of diabetic foot ulcers in particular. So that's that. Hope you guys learned something. If you have any questions, you can reach out to our office. All the information is there in all the links. If you would like to see a particular topic covered, please let us know in the comments or reach out on the socials. I'll be happy to do the research as I always do and read through any studies that I can find and then share that information with you as I find it. Hope you guys learned something, and I look forward to hearing from you guys soon.